Hey there everybody, welcome to HealthWell. Did you know that an estimated 1 billion people worldwide have low vitamin D levels? Today in our video, we're going to be talking about vitamin D deficiency and the symptoms it can cause. These symptoms and signs can occur when you're not getting a high enough vitamin D intake. Your doctor can get you to take a blood test that will show whether you're deficient in this vitamin. If you are vitamin D deficient, then this can be resolved by taking supplements or eating more vitamin D-rich foods. Let's have a look at the symptoms that may occur with this specific deficiency. Here are 10 symptoms of vitamin D deficiency. Number 1. Slow wound healing. If you have low levels of vitamin D, you may find your body struggles to heal wounds. It's been discovered that vitamin D increases the creation of compounds crucial to producing new skin during the process of wound healing. A study was carried out on people having dental surgery, and it was found that specific parts of healing were negatively affected by vitamin D deficiency. On top of this, it's thought that vitamin D's ability to fight infection and control inflammation in the body is helpful to get wounds healing properly. Another study looked at people suffering from diabetic foot infections. It was discovered that people with a vitamin D deficiency had a greater likelihood of high levels of inflammatory markers, which can be problematic for successful healing. Number 2. Becoming ill or getting infections often. Vitamin D plays an important role in your body by strengthening your immune systems so you can fight off bacteria and viruses that make you unwell. Vitamin D works directly with the cells in our bodies that fight off infections. Sometimes, when you become ill with the flu or a cold, this may be due to you having low levels of vitamin D in your body. There have been several studies carried out that show there's a link between respiratory tract infections such as colds, pneumonia, and bronchitis, and a vitamin D deficiency. Other studies have found that if you take up to a 4,000 international unit dosage of vitamin D per day, you can lower your chances of developing respiratory tract infections. Another study found that in people suffering from COPD, a chronic lung disorder, only those who had a severe vitamin D deficiency were able to experience a notable benefit after consuming the vitamin every day for a year. Number 3. Back and bone pain. Vitamin D can help to keep our bones in good health, and it improves the absorption of calcium into our bodies. If you suffer from lower back pain or bone pain, these could be signs that you're deficient in vitamin D, and studies have been carried out to show the link between the two. One study looked at over 9,000 elderly women to examine the link between back pain and vitamin D levels. It was found that women who had low vitamin D levels were more likely to suffer from back pain. In another study, people deficient in vitamin D were found to be almost twice as likely to suffer from bone pain in their ribs, joints, or legs compared to people with healthy blood levels. Number 4. Tiredness and fatigue. We can experience tiredness and fatigue for many reasons, and vitamin D deficiency can be one of them. However, for some reason, deficiency in vitamin D is often overlooked as a reason for tiredness. There have been studies that show people with low levels of vitamin D in their blood experience fatigue. In the case of one woman who experienced headaches and chronic daytime fatigue, it was discovered that she had extremely low levels of vitamin D in her blood. The woman was given supplements, and her vitamin D levels increased to a healthy level, and her symptoms disappeared. This woman was extremely low in vitamin D. However, even being slightly low has been found to cause tiredness and low energy. A study was carried out to look at the link between young women with fatigue and vitamin D. The women with levels under 20 nanograms per milliliter were more likely to experience tiredness and fatigue than women with levels higher than 30 nanograms per milliliter. Number 5. Hair loss. A nutrient deficiency can be the cause of severe hair loss. It's thought that hair loss experienced by women is linked to low levels of vitamin D, but more studies need to be carried out on this. The autoimmune disease alopecia areata causes severe hair loss, and it's also associated with the disease rickets, which causes bones to become soft because of a deficiency in vitamin D. Low levels of vitamin D are associated with this alopecia, and the deficiency could cause people to develop the disease. A study found that low levels of vitamin D were associated with severe hair loss in people suffering from alopecia areata. Hair loss can be caused by a variety of nutrient deficiencies. It's best to get checked out by a doctor so you can be sure of what is causing your hair loss. Number 6. Depression. Depression can also be a sign that someone has a vitamin D deficiency. Studies have been done that have shown the link between this deficiency and depression, especially in older adults. In one particular analysis, around 65% of observational studies discovered an association between depression and low blood levels. However, the majority of controlled trials were unable to show a relationship between them. Researchers stated that the reason for this lack of relationship in controlled trials was because they had used very low vitamin D dosages. They also thought that the studies had not been long enough to discover the full effects of the vitamin D supplements on the participants' moods. Other controlled studies have found that giving people with depression vitamin D supplements can help to improve their mood and ease symptoms of depression. This included people with seasonal depression. Number 7. Bone loss. As we mentioned earlier, vitamin D is important for our bones and helps them to absorb calcium. People who have had bone loss tend to think that they need a higher intake of calcium, but they could be suffering from a vitamin D deficiency on top of this. Older people are at a higher risk of developing fractures due to low bone mineral density, which suggests bones have lost minerals including calcium. One study looked at over 1,000 middle-aged women who were in postmenopause or menopause. The researchers found an association between low bone mineral density and low levels of vitamin D. Despite the research, a healthy intake of vitamin D is a good way of looking after bone mass and therefore reducing the chances of fractures. Number 8. Muscle pain. It's thought that vitamin D deficiency could be the cause in some cases of muscle pain. A study found that of those with chronic pain, 71% were deficient in the vitamin. The vitamin D receptor is actually found in nerve cells that sense pain, named nociceptors. A study on rats showed that vitamin D deficiency led to sensitivity and pain because of the stimulating of nociceptors in their muscles. There have also been studies that found that taking vitamin D supplements in a high dose could reduce different types of pain in those who suffer from the deficiency. A study looked at 120 children suffering from a vitamin D deficiency and experiencing growing pains. It was discovered that just one dose of vitamin D reduced their pain levels by around 57%. Number 9. Weight gain. Sometimes a deficiency in vitamin D can cause people's appetite to increase and therefore lead them to gain weight. Studies have shown that being obese and overweight is linked with low vitamin D levels, and healthier levels of the vitamin are linked with a reduction in body fat. This is thought to be due to vitamin D's controlling of a hormone in our bodies called leptin. Leptin can help to inhibit hunger in our bodies and reduce the storage of fat. So, if you're deficient in vitamin D, then your body can struggle to produce leptin at healthy levels, which may leave you overeating and therefore gaining weight. It's also worth noting that if you're overweight or have a large muscle mass, you'll require higher doses of vitamin D compared to people of a lower weight. Number 10. Head sweats. A symptom of vitamin D deficiency can be head sweats and a sweaty scalp. So if you notice you have an overly sweaty scalp, you may not be consuming enough vitamin D. This is actually the reason why babies are checked for a sweaty head in the first few months of their lives. Healthcare professionals check for excessive sweating and sweaty scalp because if present, it can show the baby is deficient in vitamin D. Do you think you get enough vitamin D intake? Have you noticed any of these symptoms in yourself? Let us know in the comments section below. And if you enjoyed watching this video, please subscribe and turn on the notifications so you don't miss out on any of our videos on health, wellness, and much more. See you in the next video, and thanks for watching.